Hello class, my name is Jonathan Flores and this presentation will be about the challenge of heart disease among African Americans. We will be talking about the several factors that contribute towards this ongoing issue, while also proposing how to help decrease it. In 2017, the CDC stated that African Americans are twice as likely to be diagnosed with and die from cardiovascular conditions than whites. Although African Americans make up only 13% of the American population, there are higher reported cases of heart disease among this race than any other population. Some of the most common factors that make African Americans more susceptible to heart disease are obesity, hypertension, and diabetes. Although the overall death rate among African Americans between the ages of 18 and 49 has increased in recent years, the financial and physical and psychological burden of heart disease on African Americans continue to grow. Poor social determinants of health are some of the main causes of poor cardiac health among African Americans, and these include a lower access to healthcare due to the higher rates of unemployment, racial discrimination, and poor environmental conditions like housing and sanitation. There are tendencies of poor diet and behavior-related choices among African American populations. A significant number of African Americans cannot afford to live on healthier food options. Instead, they have access to a variety of affordable foods that are high on cholesterol and salt. This contributes to their poor diet choices. But why does this problem persist? Well, that's because of the unwillingness and or the inability to engage in healthier behavioral choices. African Americans are less likely to take advantage of health education and other initiatives due to the previous poor experiences in their healthcare system. Another reason why this problem persists is because residential segregation. This racial and ethnic segregation has contributed to racial disparities that have a direct impact on heart disease. Predominantly African American neighborhoods are more likely to have poor healthcare services, and this contributes to poor health outcomes. There have also been several prior attempts that have focused on the public health education of African Americans about behavioral change. That is, better dietary practices, getting enough sleep, and also engaging in physical activities. And of course, the avoidance of smoking is another great important option that has also been tried to be implemented and processed. Even with worldwide campaigns which would also greatly help decrease the chances of African Americans from having a heart disease. There are deficiencies and behavior change interventions. The poor conditions in which a large number of African Americans live cannot allow them to make changes to their diet, even if they're willing to. A significant number of African Americans can only afford fast food or processed foods. Some reports have shown that the previous experience of African Americans with healthcare professionals have made them reluctant to follow their recommendations on behavioral change. This population believes that the government and healthcare professionals are not concerned about their well-being as a result. As opposed to rolling out education campaigns on diets and physical activities, I propose collaborating with trusted community leaders to talk to the population about preventive interventions available to them in their neighborhoods. They may be more willing to listen to the healthcare professionals when they collaborate with religious leaders and teachers, among others. We must keep in mind that the prevalence of heart disease among the African American population continues to grow. Heart disease is also preventable, and my goal is to use this project to promote health education to help people live a healthier and happier life. For this project, our main target audience will be African Americans between the ages of 18 and 50, as I believe these are the groups of people that are most of the time affected by this problem, and I think that they will greatly benefit from the health education that will be provided to them. We will also have a variety of tools so that we can deliver our proposal in an efficient and effective manner. This will be with the use of bulletin boards in our community and the most important one, social media platforms, such as Facebook, Instagram, WhatsApp, and Zoom. The Centers for Disease Control and Prevention reports that even though heart disease is the leading cause of death in the United States, the term can refer to several types of heart conditions, and the most common disease being the coronary artery disease, which can later lead into a heart attack. The main purpose of this proposed solution is to improve health promotion and promote behavioral change within the target population. In order to reduce the prevalence of heart disease, the target population will most likely be interested in participating in physical activities, and this will most definitely improve their health as they become more educated on the subject. It is important that we deliver the message with evidence and delicacy, as changes in the attitudes of the target audience towards health promotion will be the key in increasing in the uptake of prevention initiatives and also seeing positive results immediately. Aside from the target population, which is the African American, heart disease is a global problem that affects various populations. This activity will allow the rest of the population to educate themselves about the problem and also use some of the proposed solutions given to take into consideration to their advantage. To conclude, my proposal will also seek to change the perspectives of the targeted audience about healthy behaviors and health promotion. I am a true believer that life is precious, and my mission is to help those in need live long and healthy lives. Thank you.